about this. Tania DaSilva joins me now. She's a child, youth, and family therapist. Great to have you back on the program, Tania.
Nice to see you again.
Talk to us about, mental health. Good mental health is critical for all of our children, for youth and for teens. But what are you seeing happening right now? Let's sort of put the pandemic aside. What are you seeing happening among our youth in Canada?
I think because it's been going on for so long, kids are really struggling now to see the end of this. Like back in March, they're like, okay, this is going to pass, and then we're going to go back in September and everything's going to be okay. And what I'm noticing is a lot of our kids, they're really struggling with the isolation portion of it, where they're not seeing their friends, they're not going out to extracurriculars, and like the uncertainty of it as well, the routine, the predictability, and the fear of things never going back to what they remembered, I think is really kind of weighing heavy on them. And I think it's just because of how long it's lasted. If it was a short little bout, then I think most of them would be okay with their mental health. But because it's so stop and go, they're really struggling to see the light at the end of the tunnel.
Is there a concern, and we've talked about this many times with yourself and other experts, about the health crisis post COVID-19, PTSD, the mental health crisis that we're going to needing to deal with, needing to address? Is there a concern that that will spill over into our Canadian youth as well?
I think so. I've noticed lately that, even with all the mental health supports out there, a lot of people aren't really using them the same way because they're at home or nothing's really going on. So they're kind of just isolating and going through the motions. But I think once everyone starts reemerging, a lot of our kids who had anxiety, they're going to be a lot more anxious to go back into the world. A lot of our kids that struggled socially with social skills and things like that are going to have a hard time readapting. So I definitely think we're going to see a spike in mental health issues when we do go back and the expectations are higher and the socialization is a lot more.
Yeah, and just as you say, just being able to readjust now to saying it's okay to be doing all these things and to be playing with your friends. And having these conversations with our kids, that's one thing I know experts such as yourself say, talk to your kids, find out how they're doing, give them a comfortable, open space, a safe space where they can talk. How critical, or more so critical, is that nowadays?
It is really important because I think a lot of people, and what I've noticed, not even just with kids, even with adults, they're like, we've talked about this for months, like there's nothing else to talk about. But then that creates another issue where we're not talking about it at all. So I always encourage parents, even if we're having the same conversations and the same check-in, you still want to do it because you don't know how they're feeling that week or that day. So it might be we're having the same discussions, we're asking the same questions, but you never know what they're going to open up with or what they're struggling with, during that part of their day or during that part of their week, especially as things start getting more difficult.
So how do you encourage that? And it's hard because you could be dealing with little ones like, those that are in kindergarten to, your kids that might be in high school, even university. We know many first-year university students, they'll never experience that, that coveted first year.
Well, and we always like to look at it. I like to simplify everything. So we use a helping or hurting strategy with little kids as well as with teens where, what's happening? What are we doing? What are our choices? What environments are we in? And are these things helping our mental health and helping us push through and feel better? Or are they actually hurting our mental health and, eventually going to cause bigger issues? So I find it's an easy check-in where even with, some of our kids, they're staying up really late now because they're gaming and then they're struggling to wake up for school in the morning. So instead of lecturing them about how that's wrong, I'll simply prompt and be like, do you think that's helping you or is it hurting you to stay up that late and then to have to sign on to school and, focus and get through? And then they start self-reflecting themselves. And this works with young kids too. We do it with kids as young as, 5 and 6, and they're like, oh, actually, what, I guess that's hurting me. So it's very simple ways to prompt them and get them to kind of develop their own self-awareness.
Yeah, it's great tips there, and such so critical to make sure that we're keeping an eye on how they're managing all of this. Tania DaSilva, thank you so much for coming on the program to talk about this. You stay safe. We'll talk to you again soon.
You too. Take care.